Hey parents, torticollis can be a stressful and troubling diagnosis. It sometimes seems like it's a never-ending battle to work to get things not only back on track structurally, but also with their child's overall development. As pediatric chiropractors, we specialize in the care of these common infant challenges, and the one thing that we can tell you is this: so many of them are missed by the average pediatrician that's just focused on the symptoms. In this video, we're going to cover the four main things you need to know about torticollis and also plagiocephaly, including how to find out if your child has these challenges, and if so, what can you do to help them naturally. The one thing that we have noticed in our office over the last several years or so, with the rapid and significant rise in birth interventions and birth trauma, we see more and more cases of torticollis that comes into our office every single year. Unfortunately for most parents, traditional medicine has not updated their understanding of what exactly is torticollis and what's causing it, but also what's the best way to take care of it. For some time, leaving most families with traditional treatment options such as physical therapy that does not get to the root cause of the problem. So we have Nathan in our office. He has torticollis and it is affecting his quality of life in many different ways. He struggled to hit his milestones. He feels stiff, he's uncomfortable, and he also just lacks that energy most of the time, and he suffered from constant ear infections over the years. Now, his mom was desperate to find help and relief for her baby because his occupational therapy just wasn't doing the trick. While researching one night, Nathan's rock star mom stumbled upon chiropractic care. Fortunately, there does seem to be a shift happening in this generation of parents who understand that maybe there's alternatives to the traditional medical kind of pyramid. She was seeking out pediatric chiropractic, and she did it very, very early on in Nathan's journey, which is incredible. It provides results with a very gentle and effective, long-lasting approach to that torticollis. Now let's take a few minutes to just dive deep into torticollis and understand how does it happen, but what is that root cause? Torticollis is diagnosed medically as congenital if it is caused by abnormal positioning of the fetus while in the womb, which is more common with things such as if you have a breech position or if there's lowered amniotic fluid. The most common form of torticollis is acquired, however, and the most common cause of the amount of physical strain, tension, and pulling placed on the baby's head and neck during birth interventions such as forceps delivery, vacuum extraction, and many times it leaves that child with significant subluxations that then contribute to torticollis either then or down the road. Subluxation has three main components. First is misalignment and abnormal positioning of the spinal vertebrae. The second is fixation and reduced range of motion in the segment and region of the subluxation. And third is the neurological interference and imbalance caused by reduced amounts of proprioception and the increased amounts of nociception. Simply put, the more severe and apparent the torticollis, and it is related to the misalignment and fixation, the more severe the subluxation patterns are likely for the child. Now that we know what is the most common causes of torticollis and also why is it missed so often completely by pediatricians, the first thing that we'd encourage parents to do is if they're concerned with their child or that their child may have torticollis, it is not just relying on the pediatrician, what you've been told, or a doctor's exam of findings. Of course, pediatricians are trained to perform physical exams in such a way as to spot neuromuscular challenges just like torticollis. Still, however, they don't have nearly the experience or detailed training in these systems as pediatric chiropractors or physical therapists would. If the pediatrician does spot a torticollis for a child, they most likely will make a referral to a PT, who then will show the parents a few positioning and stretching exercises that they can do at home to try and help alleviate the torticollis. However, most parents report to us when they come in that those stretches and exercises are extremely painful for the child and almost tend to aggravate the condition because it leaves the child in a sustained state of fight or flight tension, something that is also known as dysautonomia. In our office, we have a team of other docs and professionals that work to support all of our kiddos and their developmental processes and their game plan. There is a time and place for everything. What we have found over multiple cases that traditional treatment options such as physical therapy and helmets, they don't always get to the root cause and the neurological component of torticollis. This is why parents routinely report that when they put pediatric chiropractic as the foundation and the first choice for their child's torticollis, it then makes all of the physical therapy, the OT, and everything else work easier and far more effective. As PX docs here at GPC, we love nothing more than working in conjunction with your child's therapist team to get those maximum results. Pediatric chiropractic's approach to caring for torticollis is so often the one that parents feels makes the most sense, and it can be summarized in 3 simple steps. First, we need to find and locate the exact location and severity of the subluxations. We need to make a gentle and neurotonal adjustment to relieve the tension and remove the subluxations. And third, we need to encourage parents to watch closely for a reoccurrence of that torticollis around growth spurts, teething, colds, illnesses, or other stressful events that that child may experience. Pediatric chiropractors look deeper than any other practitioner, using things like insight scans to really locate the exact stress and dysfunction of the neuromuscular system. One of the real keys to caring for torticollis is not just using positioning and range of motion testing as the only clinical criteria to resolve the condition. As pediatric chiropractors, we routinely examine and evaluate kids ages 5 and up who had torticollis as an infant, did traditional medical and therapy treatment only, and they still have retained torticollis all these years later. That is easily found in our exam and our neurological evaluation. In many cases, parents can start to see the results and see their child experience relief in just a few visits overall. It generally takes a few weeks or even a few months to get full resolution of the torticollis. Before we get started, we will sit down and really go over what's called a report of findings visit and show you and discuss your child's exact personalized care plan and how long we believe it will take to get you to those goals. There is no cookie cutter approach to torticollis. Each child gets the same stretches and position exercises, and the examination and scan process is crucial to making sure we find the exact root cause of your child's challenges and to make sure that the right adjustments are done so that we get things taken care of and out of the way. 1 month into Nathan's care plan, his digestive issues, his eczema, all of that started clearing up in a month or two when his mom saw a huge difference. His mobility has improved drastically. He started hitting milestones and said goodbye to his ear infections. Now, if you're a mom or have a dad gut that is telling you that there is something going on more than what you're being told by your pediatrician or your therapist, then neurologically focused chiropractic is perfect for you. We specialize in really diving deep and doing more thorough assessment than anyone else out there right now, making sure that we get to the root cause of the torticollis. This information reaches home for you and your children. Please ask any questions or leave a comment below or send us a direct message. Or if you know someone that may have kids or family members that need to hear this information, please share this with them so that other parents, families, or Facebook groups who need to hear this has that opportunity. I hope this information is beneficial, and we hope that it helps you learn more about those natural options to torticollis and what really might be the root cause.